It's responsible for 90% of cervical cancers, 90% of anal cancers, and roughly 70% of throat cancers. About 20 million Americans between 15 and 50 have it, and it can spread even before an infected person shows signs or symptoms. Are you at risk?
So we've learned so much more about this virus over the last few years. You know, it doesn't just cause warts.
Right.
You know, it can, in some cases, lead to cancer. And most people don't think much about it.
Right. And what is also scary is that you can be exposed to the HPV virus, the human papilloma virus, without actual intercourse. So it can be passed from skin to skin contact. It can be passed during oral sex. And by the age of 50, 80% of women have been exposed to this virus. So you need to know about it. We don't want you to panic about it, but it needs to be on the front of our radar.
And you say this virus, really, it's the family of viruses. And, you know, some do just cause unsightly warts and things of that nature. But the ones that we're particularly worried about are the ones that can lead to cervical cancer, oral cancer,
vaginal cancer, vulvar, anal.
And I have to just emphasize this head and neck cancer. I mean, we're seeing a surge in that HPV 16. Is the type of virus, and we're seeing it in younger kids because of exactly what you said, the oral sex part, and the fact that they're particularly virulent forms of head and neck cancer. So nasopharyngeal cancer, base of tongue, floor of mouth, all of those areas. So
and
again,
what's scary to me, Drew, as you know, is that you can't screen for oral cancer like we can screen for cervical cancer. So typically those cancers are detected at a relatively late stage. The good news is that some of those HPV oral cancers tend to be the most responsive to treatment. But people need to understand this is out there. This is like catching a cold.
But it's preventable with the vaccine.
I think, yes.
That's great news, too.
I think the exposure to HPV is difficult to prevent because you would have to be living in a plastic bubble.
You're going to be exposed.
But yes, you can absolutely
Is that one of the things you try to highlight, particularly to parents?
Oh,
because, you know, they do think of this as a vaccine for sex.
Right, and a lot of parents are resistant giving their 11-year-old daughters a vaccine against an STD, but you got to give it to them before they become sexually active.
And it's also, as you know,
just
Jim,
reality.
and I, as a mother of a son, I know, and you know, that it is now approved and recommended by the CDC
Takes
for
two
boys.
to tangle, so
usually,
let's give it to both.
But again, I think before we leave this subject, you started off with a really important point, which is it doesn't require intercourse to pass this from one person to the other. It is ubiquitous, and that's why we said this is something you should be worried about.
While it may not be the subject of casual conversation, rectal bleeding is something you should discuss with your doctor. But very often people are embarrassed and brush it off.
A lot of people unfortunately come in and think, oh, I have bleeding from my bottom, it's just hemorrhoids. And that's not always the case.
When someone presents with bleeding, the first thing doctors want to do is rule out cancer.
We have to work them up in conjunction with our gastrointestinal colleagues to make sure that there's no bleeding from the rest of the colon or in the rectum, and make sure that there's no polyps or cancers and these things present.
Most times the bleeding results from either a hemorrhoid or a fissure. Both are visible on a rectal exam. While they may have the same endpoint, they are very different conditions and have different symptoms that set them apart.
If they're having pain, it could be an anal fissure. And an anal fissure is a tear in and around the anus that can cause quite significant amount of pain.
Generally caused by trauma, strain, or bowel disease. Fissures are associated with pain and blood during a bowel movement. A hemorrhoid is an engorged or inflamed vein in the rectal region. Clotted or external hemorrhoids may involve a lump, and constant discomfort not limited to using the bathroom.
There's inside hemorrhoids and outside hemorrhoids, and they're overall treated similarly. They're somewhat different. An outside hemorrhoid may present with pain and usually a large purple bump. And if that is slowly going away, usually resolve on its own.
Over-the-counter medications and lifestyle and diet changes can usually rectify the problem. Your doctor may suggest further treatment if symptoms persist. For Lee Memorial Health System, I'm Amy Osher.